Thank you, Madam Speaker. I am pleased to rise today to speak to Bill 81, an act to amend the Employment Standards Act. And I think it's important that we don't lose sight of the different types of standards that we're talking about. We are talking about the minimum wage, which absolutely, to quote the minister, has been downright embarrassing to be the lowest in the country. And there are other standards that we need to look at. One that is especially relevant right now, almost 2 years into a global pandemic, is sick days. And we know that many people don't have access to paid sick days in New Brunswick. And this is unacceptable. It was important before the pandemic, but I think the pandemic has highlighted the gaps in our employment standards. And so, one of the things in this bill is to provide 10 paid sick days for employees. And there are lots of reasons to do this. And I think that it's important to, as we look at sick days and think about the pandemic, to think about why it's important. One reason is a public health reason. We don't want people to be choosing between staying home to protect public health, to do their best to avoid spreading COVID to their coworkers, to anyone they might encounter, having to choose between that and trying to, contribute to public health and trying to put food on the table, trying to pay rent. And there have been many discussions recently in this House about affordable housing, and unfortunately, there's still a long way to go. Because when we're talking about sick days, when we're talking about the minimum wage, this isn't in a vacuum. This is in a situation where there is a lack of affordable housing, where people can't pay their rents, where just today I'm talking to constituents who are unhoused. And the best solution for them right now is to try to couch surf. That's the best option they have right now. It's not acceptable. And so, employees need to have sick days in the pandemic and beyond the pandemic. This is something that happened even before COVID, where people would end up having to go to work. They didn't feel they had the choice to stay home because it meant their power wouldn't get paid. There wouldn't be food on the table for their family or themselves. And they could spread other germs as well. There are other reasons. It's not just about if there's a contagion, if there's a pandemic. There's preventative health care that can happen. We talk about public health, we talk about population health. People need to be able to make an appointment to go see their doctor. People need to be able to, whether it's manage a chronic illness, whether it's to make whatever appointment they need to be able to have access to that time. People who have caregiving responsibilities, they need to be able to fulfill those caregiving responsibilities if a child or another person they're caring for is unwell. And I think it's important to note that a lot of these employment standards, a lot of these things we're talking about disproportionately impact certain people in the population. They disproportionately impact people with lower incomes. They disproportionately impact women. They disproportionately impact, in some cases, youth, but often it's caretakers, and that's often women. And we need to recognize that there's a gendered lens that needs to be applied to this. And we could talk about pay equity. We could talk about how if we want to see some leadership, it'd be great to see some pay equity legislation for the private sector come forward as well. But we need to have 10 annual paid sick days for people in our province so that they can stay home when they're sick. There are benefits that come with paid sick leave. That's reduced absences from sick workers because they can actually take care of themselves and recover quickly. I mentioned preventative health and reduced presenteeism, and so that's where people are showing up but they're unable to work because they're sick, so there's a body there but they're not really able to be productive and they're not able to recover. It's important for staff recruitment and retention, and that is something that is a major obstacle for a lot of employers in this province, is recruitment and retention. And we've talked actually a lot about wages and about working conditions when we've been talking about unionized workers, and we've talked about how important it is that there's good working conditions, that there's benefits like paid sick leave and adequate wages. And I've heard references to crossing the border. Well, do you know what? The nurses are earning a lot more on the Nova Scotia side than on the New Brunswick side. But again, that's for a different debate. But this is absolutely important. So that's one of the things in this bill. So I don't want us to lose sight of what is actually in this bill. Workers' rights. There's a long history of people having to fight for rights, to have weekends, to have overtime pay, to have actual work hours scheduled, to have holidays off, to have parental leave, to have sick leave. And again, not everyone even has access to everything here, but there's a history of that, but we haven't gone far enough. So we need paid sick days. We need the overtime to actually reflect the wage that someone is earning. That's not the case right now. It's double the minimum wage, not double their wage. That's something that is in this bill. We need to ensure that, but going back to how much people need to earn to survive, we need to have an adequate minimum wage. And I think that something that keeps coming up today is that we're not even talking about living wages. We're talking about moving closer to a living wage when we talk about $15 an hour. There's still a ways to go after that to get to a living wage. And I think it's important to talk about the definition of a living wage, because a living wage is the hourly wage that 2 working parents with 2 young children must earn to meet their basic expenses. So we're talking about a living wage where it's a two-income household. What about the single parents? What about when there's 1 income? We're not even, frankly, we're not even in the realm of what people need when we talk about the announcement this morning. Moving in the right direction, but leadership is not 5 cents ahead. That's not far enough. When we look at the cost of living, we know that it's gone up. We know that the housing is unaffordable. We know that so many children in this province are living in poverty, and we can do better. We have to do better. And one of the things that does need to be done as we implement an improved minimum wage, as we implement sick days, is that the small businesses, the nonprofits, the cooperatives need to have some support to be able to transition towards being able to do this. But as has been mentioned by my Green colleagues, it's important that workers are not, now I have the French word, subventionné, like they're not subsidizing, thank you, they're not subsidizing the economy, they're not subsidizing their employers. We need government to support this transition with a transition fund in order for workers to be earning enough to pay their bills. And that is absolutely essential. For those that require it, that's what needs to be done. And you know, there's a long history of helping certain businesses in this province, making sure that there are tax breaks, that there are certain property taxes, that are certain rates. We know that there always seem to be handouts for certain companies. There's always millions of dollars to be found for things that are priorities. So let's talk about our priorities. Is it a priority for people to be able to survive on the minimum wage? The minimum wage should at least cover what people need to get by. And frankly, that is not happening in this province, Madam Speaker. So we should be helping these small businesses and not incentivizing huge corporations. And there should in no way be a race to the bottom. We talk about competing with other provinces. That's what we need to do, and we need to do it on the side of sick days as well. Again, we're still in a pandemic. We're seeing case numbers very high. We need this for the workers of this province, Madam Speaker. And we need to work towards eliminating poverty. We need to ensure that people who work full-time don't live in poverty. That is absolutely unacceptable, Madam Speaker. And we know that women are about 1.4 times more likely to work a minimum wage job, Madam Speaker. So again, this is disproportionately impacting women. So there would be positive impacts towards gender equality if we were to increase the minimum wage. And as has been mentioned earlier today, not everyone is even earning who's earning minimum wage even has full-time hours. And again, disproportionately women make up part-time workers. So we can help people to move out of poverty and this is one of the pieces of this. Of course, no one piece of legislation is exhaustive. There are other things that need to be done in our society to move in the right direction. But this is one step in the right direction. What I would say, Madam Speaker, is that in this legislative process, I've heard many speakers today say they agree with the spirit of the bill, they agree with what's in it, they're not sure about a detail, they have some questions. Let's send this to committee. That is an option. Vote yes, send it to committee. As I hope everyone here knows, it won't become law if we vote yes to send it to committee, but we would show that we're actually voting our conscience and actually voting to send something, to ask questions, to investigate it more, to amend it if needed. We could move this forward, and again, we could implement paid sick days. We could have a better minimum wage. We can actually debate this and invest the time needed to improve the employment standards in this province. Because, Madam Speaker, right now, it's not acceptable. This is absolutely an unacceptable situation for the workers in this province. And we've talked today about thousands and thousands of people who would benefit from the proposed legislation. And we need to make sure that happens. So I urge the members of this House to vote yes, send this to committee. And it would be great if at committee we could even have witnesses. That's something that we've been pushing for, to be able to ask some questions, to investigate more if needed. So, Madame Speaker, la chose, c'est que nous ne voulons pas même. On ne devrait pas avoir la pauvreté, les banques alimentaires, des choses comme ça, mais dans notre système, voilà, c'est ce qu'on a. Il faut qu'on adresse les choses comme ça, mais au moins il faut adresser avoir un salaire minimum de $15, avoir des options pour les gens qui sont malades. C'est inacceptable, Madame la Présidente. La situation actuelle. Alors, nous pouvons choisir quelque chose d'autre. Tous nos systèmes, on a créé ces systèmes. C'est les gens, c'est les députés qui ont créé les règles, les systèmes, les lois, les projets de loi. Et nous pouvons choisir quelque chose d'autre. We can choose something different, Madam Speaker, because the laws we have, the systems we have, the economy we have, were created by people, were created by MLAs, and we can choose something different. We can choose to have better employment standards for the people of New Brunswick. We can choose to support small businesses and nonprofits and cooperatives. We can choose to make sure people have paid sick days in a pandemic. These are choices, and so I urge the members of this House to make the choice to send this to committee, to move this forward, to discuss this further, and to not let this die here today on the floor of the House, because that, unfortunately, happens all too often when there are good ideas. So let's move this forward. I urge all the members to vote yes, and I thank you very much for your time, Madam Speaker.